We are a team from the Cardiology Center of Beijing Chaoyang Hospital, Capital Medical University, and the Beijing Key Laboratory of Hypertension. Today, we are honored to share with everyone here our recent publication in iMeta, Intestinal Microbiota by Angiotensin Receptor Blocker Therapy Exerts Protective Effects Against Hypertensive Damages. Intestinal flora has an essential role in developing hypertension. Disordered intestinal bacteria may lead to elevated blood pressure and damage the heart, vessels, and kidneys. Some ARBs, such as valsartan, can significantly alter the gut microbes in animals. We previously demonstrated that ACI/ARB administration in hypertensive patients results in significant differences in intestinal flora composition and serum metabolites. However, little is known about whether intestinal flora is involved in the antihypertensive effect of ARB, and the exact role and effect of gut microbiota after ARB administration remains unclear. We conducted FMT in donor SHRs who received valsartan therapy or not. In hypertensive animals that received FMT from ARB donors, BP dramatically improved. Morphological analyses of arteries revealed that the media thickness and area, vessel diameter, and media/lumen ratio representing vascular remodeling were similar between the groups. In contrast, the severity of vascular fibrosis was significantly alleviated upon ARB-FMT compared with NS-FMT. To confirm that the intestinal flora in SHR recipients was reconstructed after FMT, fecal microbiota analysis of NS-FMT and ARB-FMT rats was performed by sequencing the 16S rDNA gene. Bifidobacterium, Coppercoccus, and Clostridium were prominently elevated in ARB-FMT group, while Lactobacillus, Ocelospora, Aggregatibacter etc. were notably reduced. In ARB-FMT group, fatty acid beta-oxidation and L1,2-propionediol degradation but decreased in L-arginine degradation, fatty acid salvage, and ornithine degradation. Transcriptome alterations in host gut tissues were investigated to explore other mechanisms. Differential analysis demonstrated that ARB-FMT treatment significantly augmented the expression of 56 genes and abetted the expression of 19 genes in the gut. The reduction of Nfil3 and Arntl, as well as the upregulation of CRT, CYP, PER1, TEF etc. were consistently observed after ARB-FMT. Go enrichment analysis indicated remarkably enhanced potentials of circadian rhythm in ARB-FMT rats, but deficient abilities to constitute cyclin-dependent protein serine/threonine kinase and protein kinase holoenzyme complex. We speculated that WC-FMT alone might not be sufficient enough to reduce BP in SHR but could enhance the therapeutic effects of ARB. Hence, ARB was administered following WC-FMT treatment to explore whether pretreatment and the presence of partly restored gut microbiota from WC hypertensive donors would prominently facilitate the protective effect of subsequent ARB therapy. The gut microbiota from WC hypertensive donors enhanced the BP-lowering effect of valsartan. Again, microbial influence on arteries was mainly detected in alleviating fibrosis, but was not evident in the vascular media and lumen. Hence, the intestinal flora that characterizes FMT versus non-FMT SHRs under ARB administration was determined. Microbes markedly enriched in FMT plus ARB-treated animals were Phascolactobacterium, Paraparvitella, Bilophila, and Helicobacter, whereas the depleted bacteria included Pediococcus, Megasphaera, Gelister, Agar etc. WC-FMT has an impact on the gut microbiota function of ARB intervention in SHR rats, promoting the metabolism of linoleic acid and tryptophan, the degradation of valine, leucine, and isoleucine but suppressed O-glycan. FMT also led to profound shifts in the gene expression profiles. In ARB plus WC group, 1,093 dramatically increased, and 835 genes decreased. The reduction of DUOX2, as well as the upregulation of ASA2, LCT, ALPI, C etc. were affected by WC microbiota in ARB rats. The genes enhanced by WC-FMT were implicated in monocarboxylic acid, fatty acid metabolism, and lipid catabolism, while those depleted had a crucial role in the immune system and inflammatory response. ARB-modified gut microbiota in both hypertensive patients and animals exerts a protective role on vasculatures, intestinal functions, and metabolism, which cooperate to lower the BP of the host. Our observations provide insights into the crosstalk between gut microorganisms and hypertensive damage improvement during ARB therapies, which advances our understanding of the mechanisms underlying the response of hypertensive patients to clinical therapies.